Before an NHS Trust approves you for a clinical attachment, they're going to want to run some checks. And hence, you're going to have to provide some documents. It's a good idea to know what sort of documents they may ask for so you can prepare them quickly to avoid delays. Every trust will have a slightly different list of documents that they ask for. The list I've compiled will hopefully give you some idea, but it may not be exhaustive. So number 1, ID documents. They're going to want a valid passport. Some trusts might also ask for a valid national ID or driver's license. Number 2, visa. So if you're coming from abroad, most likely you're going to need a standard visitor visa. But if you're already in the UK on some other visa, you'll have to provide them with the details of that. Number 3, police clearance. So again, if you've been living in the UK, then this might mean a DBS check. But if you're coming from abroad, this might mean a police clearance certificate from your home country. For proof of address, so wherever you're living, ideally have 2 proofs of address. Number 5, English proficiency. In most cases, this is going to be IELTS or OET, but the GMC have a full list of what they consider as acceptable evidence of English proficiency. Number 6, PLAB results. Some trusts might only accept you if you have cleared the PLAB 2 exam, and they might ask you for proof of that. Not all of them, though. Number 7, an up-to-date CV. Over here, try to organize your CV in the format that NHS Jobs has you prepare your application. It smoothens the whole process. And if you want to know more about how you should prepare your CV, comment below CV, and I'll make a video about what format you should use for your CVs. Number 8, references. Now, this isn't a document per se. It's more that they will ask you for the work email addresses of the consultants that you've worked with. So you might need to provide the work email addresses of 2 consultants from your previous jobs. Or if you've not started work yet and have just finished medical school, then they may ask you to provide the email addresses of your professors. Once they have those, they're going to send across a reference form for your professors to fill in, essentially. And number 9, occupational health clearance. Now, here, they're going to want a full vaccination history from your part. In particular, what they're looking for will be hepatitis B, TB, MMR, and chickenpox. Once you arrive here, they're going to test your blood for adequate immunity from these illnesses. One school of thought is you could get a booster before coming here, and once they test your blood, you're already immune. Saves you some trouble of waiting around for your immunizations to happen when you come to the UK. Or if you're not immune, you come here, they'll provide you with a booster for whatever you need, and then you should be allowed to work. All you have to do is provide your vaccination history and honestly fill in the occupational health questionnaire that they provide you with. Finally, number 10, some trusts are going to want you to attend an induction before the start of your attachment. Some trusts are going to want you to complete some online training before you begin, but this is variable across all trusts. I hope this video gave you some insight about the possible documents that you may be asked for before you are allowed to begin your clinical attachment. If you want to find out how to make the most of your clinical attachment, click on the video here to find out.